Hi guys, my name is Tiffany and welcome back to another video. So in this video, I want to share with you guys the differences between the clinical nurse specialist, so your CNS, versus a nurse educator. Make sure to check last week's video where I shared with you guys my decision on wanting to pursue an advanced degree as a nurse educator. And I've talked to you guys in the past about wanting to pursue something that involved teaching and educating, and I have mentioned before the CNS role, and honestly during that time I didn't really know the differences between the nurse educator versus the CNS. And so really in my head all I wanted to do was something that involved teaching and not really knowing the differences between the two. So when I started doing more extensive research on it, I found that it was very hard to tell the differences. A lot of times people have played both roles. So at my old hospital, the CNS and the nurse educator was one person. And then at my current hospital, the CNS and the nurse educator are two completely different people. So there are some hospitals that kind of combine the roles together, and there are some roles that keep each role completely separate and they each have their own defining roles. So the whole point of this video is to kind of share with you guys the differences between the two, and also share with you guys more on my research about really what each role plays, the differences between them, and really actual experiences from those that I currently work with that kind of share with me what they define their roles to be. So hopefully this video is helpful to you guys. And so I do have my phone in front of me where I do have my notes that kind of really share with you guys the differences. So I'm just going to be reading them out loud for you. And the first role I'm going to be discussing is the CNS role. So the CNS is your clinical nurse specialist, and this is according to the BRN. So I actually pulled this from the BRN website on what the roles of the CNS is. So the CNS is an expert in clinical practice and works with the hospital to improve clinical care. They use advanced knowledge of pathophysiology, pharmacology, and health assessment. They assess and intervene in complex health problems and does consulting. They promote staff development. They also provide formal education classes and do preceptorship. They use clinical research to improve advanced clinical care. They are up to date on clinical current literature. They publish data from research topics. They provide clinical expertise and make recommendations. They also evaluate policies and procedures. They also review standards of practice and determines appropriateness to reflect current practice. They also use evidence-based clinical practice to develop methods to improve patient care. They also use theory and research as the foundation for clinical leadership. They serve as the agent of change in the healthcare setting by developing healthcare standards. So in this role, if you do want to pursue it, you do have to be a registered nurse and have your BSN. And it is a type of advanced practice program, a graduate program that is typically 2 years that involves didactics, which is lectures and clinicals. And you must be certified by the BRN, so you do have to take an exam to be able to obtain your CNS certification that you have to maintain. So it does also require you to have clinical experience as a registered nurse in order to pursue this role. So that is the role of the CNS. And now I'm going to be talking about the roles of the nurse educator before I compare the differences between the two. So the nurse educator, this is according to registerednursing.org. So this is just what I found online. It is using a knowledge base in theory of teaching, learning, and evaluation to design curriculum and develop classes. They also teach, advise, mentor, and evaluate nursing staff. They oversee clinical practice and maintain clinical competencies. They can work in a clinical or academic setting, so you can be a clinical preceptor and a clinical instructor. You must possess leadership and excellent communication skills, and you must have a comprehensive knowledge in your particular area of instruction. So if you want to pursue this role, it is a Master's of Science degree in nursing in a specialty route. So it is the nurse educator specialty route. So there are different types of specialty routes. This is just one of them. And so make sure to do your research if this is something you wanted to pursue on the different types of specialties. And so it is a advanced graduate program that is typically 2 years long as well, that involves lectures and clinicals as well. And if you wanted to become a professor, then you can go back to school and get your doctorate, so your PhD, in wanting to work more in an academic setting. So it does also require you to have clinical experience as a registered nurse as well. So hopefully that kind of explains to you guys really the roles of each, the CNS versus the nurse educator. And so now I want to share with you guys on what I have found through discussing with actual nurses that I work with, and kind of them sharing with me what their roles really are. So I have talked to a few nurses on my unit that did pursue the CNS role, and they have basically shared with me that they really, what their main focus more is on the research aspect of it, and that is really the foundation of what drives their role. And so they do a lot of research, extensive research, reading policies, and making sure whatever we do is current and up to date. And so there are nurses out there who have the CNS that basically are involved in doing a lot of research, and they do write articles and actually pursue research studies and write articles about those. So I do have a nurse that is currently active in doing that right now. She was published in a research article. And so that's kind of really her role and what she pursues. So there are some nurses, though, when I ask them whether or not they actually currently practice as a CNS, I will say that a lot of them say that they don't. And they actually found out that further on in their role as the CNS, they discovered that it was really more research-based, and personally why they don't continue pursuing it. So it is really up to you, and if you do love the research aspect of it, you love reading policies and making sure that whatever we do is currently up to date with the current standards of practice through research, then the CNS role is probably something you might be interested in. So my current CNS at my hospital is really focused on that and making sure and reading through all the policies and making sure that whatever we do is according to standards of practice. And really, she's the overseer of the unit as well, where she will come around and do consulting with specific patients. So if there's something that we are concerned about, we will go to her regarding, let's say, for example, we are concerned about this patient's possible pressure injury. And so she will come and do a consult on that and directly evaluate the patient and really do recommendations on what we should do regarding his plan of care. So that's really also another role as a CNS, where you are making recommendations on how to provide care for a patient based off of something you are concerned about. So we have had patients where my CNS will come directly to bedside and do evaluation and kind of show us like how we should do wound care and how we should focus on doing the diaper changes for a baby who has a pretty severe rash. She will do recommendations on some of the tips on how we should do cleaning and what types of creams we should use and things like that based off of current research and what has been known to work. And so that's also another role that she does as well. And so she really is our expert, that we call it. So if we are concerned about a policy or how we should do certain things, we will come to her and ask her those kind of questions. And she's really the expert on really telling us what is the current standards of practice and how we should do things at the hospital. So that is really kind of her role. And of course, there's a lot of extensive things that you have to do outside of work, where you will have to do research on certain things and making sure we are currently up to date. So both roles require you to really do a lot of time outside of work to kind of prep for things on the unit and kind of making sure everything is being maintained well. And so, yeah, it's also something that if you want to pursue this, just know that is something that you have to do. And of course, I'm the type of person where I want to just do my job and go home. But in any nursing role that you do, you're still going to be having to do things outside of work. So this is just one of those things where it does require you to do some extensive practice and research outside of work. And I have talked to my nurse educator directly on what her role is. So basically, she's told me that as a nurse educator, you're really involved in creating the outline of some of the new grad programs. So you're focused on discussing certain types of topics that we teach, and whether it's like specific systems that we're focusing on, as well as just providing the foundation for a lot of staff on basically how to care for the patient. So we're going to be focusing on head to toe and focusing on the different systems. And we have nurses who kind of, you don't have to be a specialized person in the role, but if you have a passion for something, like for example, you're really interested in teaching about the cardiac system, or you're interested in teaching about the kidneys, then you kind of really become an expert in that and doing kind of teaching regarding that. So the nurse educator does not teach all the classes, but she does create the outline and the overall kind of structure for how we teach our staff, as well as for the new grad programs. And so that is kind of our role. And then of course she will reach out to those who have certain interests in wanting to teach specific topics. And so that is one of the roles that she plays. So of course, nurse educators are more involved in like the skills hands-on teaching. So for example, if we are currently changing our standards of practice of doing line changes or something, then the CNS is more involved in the policy, writing out the policy, and the nurse educator is more implementing it, where they will have nurses come during skills lab day to actually do the practice, and they kind of create the curriculum for that and do the teaching regarding that. So that is kind of where you can see the differences between the two. And so really it's more skills, more hands-on teaching when it comes to the nurse educator role. And you're still going to be having to create the presentations, the lectures, and things like that. So that's what you're more involved with. And of course, you still have to be an expert in what you do and teaching wise, but you know, that does require you to do some sort of extent of research as well to kind of be an expert in some sort of topic that you do plan to teach. And so if that's something you want to pursue, just know that you are still having to do, like I said, things outside of work, doing research on your own on wanting to teach certain topics. And so yeah, that's kind of really the role of the nurse educator. Yes, you are evaluating your staffing and how they are implementing their care, really more direct on skills lab teaching and kind of being involved in the overall outline on how to teach certain classes and new grad programs specifically as well. So that is really the differences between the two. So as you can see, basically in summary, the CNS is more research-based versus the educator is more of the teaching aspect of it. So like I've mentioned before, in some hospitals, they combined the roles together and you are doing policy reviews, research, as well as doing the education portion and teaching your staff as well. So the role is combined together. And there are some hospitals that completely have two defining roles and they each have their separate roles. Of course, they do work together, but their roles are very defined and different. So it's really up to you to do your further extensive research. And of course, there are different programs that provide different things. And so it's really up to you to go out there to figure out what's best for you and your interest. But personally for me, after doing this extensive research, I realized that the nurse educator route is up more my alley and what I'm really interested in, as you can already see through a lot of videos that I post on YouTube, that basically I do a lot of skills hands-on teaching, and I personally learn better through that kind of way. And so I like to be able to create that kind of curriculum and be more directly involved in creating the lectures, as well as doing the skills lab teaching and doing hands-on skills with the staff, as well as for the new grads, and kind of being involved more directly through that. As much as I did want to pursue the CNS route, I felt like it really wasn't for me, just because I'm not too interested in wanting to do the research background. So that is just personally where I'm coming from and why I decided to pursue the nurse educator roles. And then for those who are currently doing their research to figure out which one is best for you, hopefully this is able to kind of clarify things a little bit more. And whichever you decide to pursue, of course, do it because this is something you're passionate, interested about. And hopefully this video is able to clarify a lot of information. So I hope this video was helpful to you, and I'll see you guys in my next video. Bye.